Hi, I'm not a therapist, I'm a patient, but join me on my couch. Today, I want to talk to you about mental health. May is Mental Health Awareness Month. Mental health often gets a bad name because when we hear it on the news, it's associated with suicide and homicide. And so we feel like mental health has to do with murder of self or others. But it's so much more than that. Mental health starts from the moment we come into this earth, when we're seeking attachment and authenticity. We're seeking attachment to someone who's going to care for us, our mother usually, or our father. And those people are going to make sure that we are connected to not only them, but the world. Authenticity is meaning that we can be true to ourselves. Those things that are just inwardly in us are valid and they are important and they make us who we are. And we have permission to be our authentic selves. Today I'm going to talk specifically about what mental health is, what a mental health break is, and then what mental health disorders there are out there, and the help you probably can get for them if you have one of those. Mental health is a state of well being. It's when you're able to cope, be productive, and contribute to society. But every once in a while, each of us can have a mental health break. It happens in 1 in 4 people over the course of a year, and it just means that life has it where you feel anxiety, depression, and or just don't feel like you can cope. There are nearly 300 mental disorders. They can be categorized into different groups, including mood disorders, anxiety disorders, personality disorders, eating disorders, traumatic related disorders, and substance abuse disorders. Um, if you think someone in your family is suffering from a mental health disorder and it's not just an isolated event, you can look for signs such as these: feeling hopeless, displaying negative emotions, being confused, having consistently low energy, being unable to complete daily tasks, go to work, cook a meal, hearing voices, or experiencing delusions. So now that we've looked at what mental health is and isn't, we've looked at mental health disorders and early signs that you can look for. Here are some things that can help. Self-help tools could be changing your environment, um, stopping substance use, limiting the amount of time that you're on social media, doing relaxation or meditation techniques. If those aren't enough, then you can talk to a therapist, and they can give you some help in terms of cognitive behavioral therapy, just being somebody that can listen and so that you can get those things out of your mind and um, can get some input in those or just get validation for those. And lastly, you can go to a psychiatrist who can prescribe medication when therapy and self-help, changes environment, and or lifestyle aren't enough. Hope this helps. Thanks for listening.